Back Pain and Your Brain, Case Study Part 1. Watch Christy's arm swing. Did you see the lack of arm swing, especially on the left? Disclaimer, this video is for informational purposes only. Coordinate any of your rehab with your healthcare professional. FYI, I am purposely oversimplifying these explanations, and we are only talking about a couple of pieces in a bigger puzzle. After another quick assessment, there is no indication that the lack of shoulder swing is from a shoulder problem, meaning her shoulder's just fine as far as arm swing. There are indications that her frontal lobe midbrain gait generation needs some rehab. Could an uneven gait contribute to back pain? Yes. If you are Christy right now, you might be freaking out. Great, I have a back and a brain problem. But she did not. She's a nurse and understands that we all have brains. And those brains drive and coordinate postures and movement. The best way to rehab your body is to purposely rehab your brain with it. Christy also has a PMRF pattern on both sides, meaning her brainstem is not doing its job of maintaining appropriate autonomic reflexive muscle tone. Could a lack of coordination between flexion and extension contribute to your back pain? Yes. For Christy, her PMRF pattern shows up as hands slightly turned in and her feet slightly turned out. So far, Christy's rehab looks like this. Sensory retraining for areas that she is lacking sensation and will target the parts of her brain that need more activation. Rhythmic and coordinated movement with her feet and hands specific to where she is challenged that also target the appropriate parts of her brain. And head and eye movements that also boost activation in the parts of her brain that need rehab. If you have tried everything and still have chronic back pain, for that matter, any kind of chronic joint pain, shoulders, knees, hips, back, anything, has anyone assessed your walking gait? When you're walking without thinking about it, is it smooth and functional? Sensory function? Are you aware of any lack of sensation, pins and needles, pain, lack of feeling warm or hot, or sharp or dull, anything like that, heavy touch, light touch? And a lot of times when people have the kind of problems we're talking about, they have sensory dysfunction and they're not even aware of it. Has anyone tested muscle function? A lot of times people don't realize it. They just feel back pain or they feel some other joint hurting, but they don't realize that the muscles around it are not working or not working correctly. How about your peripheral nerve function? Has anyone assessed that? Those are the nerves coming out of your back, down your legs, out of your neck, down your arms, especially if you're having any kind of troubles with feet and knees, especially or elbows and hands and wrists, especially if you have any pain shooting down those arms, shooting down those legs. And how about, has anyone assessed your cerebellum function? Cerebellum sits under your brain at the base of your skull and is basically in charge of balance, coordination, and accuracy. And again, when it's really bad, people obviously know they have problems with something like that. But a lot of times, people just realize like if stuff doesn't work, it hurts, and they don't realize that it is a cerebellum dysfunction. And then vestibular function. Vestibular is your brain figuring out what's upright. Hey, where am I going? And what's up, what's down, what's left, what's right? And again, if it was really bad, you'd obviously know that. But a lot of times it is off for a lot of people with the kind of problems we are talking about, and they don't realize that it's actually a vestibular problem because their horizontal or vertical is a little off and it's twisting their body and causing dysfunction. And nutrition matters. So again, hopefully somebody has assessed that and reviewed that with you as well, because these things matter. And for someone that keeps running into dead ends, these things probably need rehab. If you're the kind of person that keeps running into dead ends for these things where, okay, that rehab didn't work, and as I say this, sometimes a pill is an answer, sometimes a surgery is an answer, but in my humble opinion, in my experience, 99.9% of the time, those things are not in your best interest. It would be in your best interest to really be able to look at all the pieces, but also look at the big picture and see if everything is working together. So if you would like a coach to be able to look at all the parts and all the pieces and get them all working well to stop running into dead ends and be your best at any age, then go to totalbodyrestoration.com. Again, totalbodyrestoration.com. If you have any questions, any concerns, give me a call, shoot me a text, reply to an email, comment on Facebook, wherever you are. Get your questions and concerns answered. Thanks. I hope this helps.